1 minute. Singapore Nursing Board Important Question and Answers. 1. The clinical assignments on a pediatric respiratory unit have been made for the day. Which of the following assignments should be questioned? A. Unlicensed assistive personnel are assigned to walk children with croup. B. A licensed practical nurse is assigned to teach a class to parents on sudden infant death syndrome. C. Unlicensed assistive personnel are assigned to help children who have cystic fibrosis to eat. D. A licensed practical nurse is assigned to administer a prescribed bronchodilator to a child with asthma. Answer. A licensed practical nurse is assigned to teach a class to parents on sudden infant death syndrome. Rationale. Unlicensed assistive personnel may help a child walk and eat. A licensed practical nurse may administer bronchodilator to a child with asthma. It is inappropriate to assign a licensed practical nurse to teach a class on sudden infant death syndrome. A registered nurse should be given responsibility for teaching such a class. 2. The nurse took respiratory rates on the following 4 pediatric clients. Which of the following clients should the nurse report as having an abnormal respiratory rate? A 6-month-old infant who has respirations of 45 breaths per minute. B. A 2-year-old child who has respirations of 30 breaths per minute. C. A 10-year-old who has respirations of 28 breaths per minute. D. An 18-year-old who has respirations of 25 breaths per minute. Answer. D. An 18-year-old who has respirations of 25 breaths per minute. Rationale. The respiratory rate of an infant from birth to 6 months is 30 to 50 breaths per minute. Children between 6 months and 2 years of age would have respirations from 20 to 30 breaths per minute. Children between 3 and 10 years of age have respirations between 20 and 28 breaths per minute. The respiratory rate of children between 10 and 14 years of age is between 16 and 20 breaths per minute. The respiratory rate of children between 16 and 18 years of age would be between 12 and 20 breaths per minute. An 18-year-old who has respirations of 25 breaths per minute is experiencing some degree of respiratory distress and that finding should be reported. 3. Which of the following nursing interventions should the nurse include in the plan of care for a child with acute spasmodic laryngitis? A. Administer antipyretic. B. Provide cold steam in the bedroom from a humidifier. C. Avoid exposure to the night air. D. Administer corticosteroids. Answer. B. Provide cold steam in the bedroom from a humidifier. Rationale. Acute spasmodic laryngitis is characterized by sudden, brief laryngeal obstructions that occur primarily at night. There is no fever, so antipyretics are not administered. Corticosteroids are also not administered. Exposure to the night air may terminate the laryngeal spasm. It is appropriate to provide steam from a hot bath or shower or cold steam from a humidifier to relieve mild clinical manifestations. 4. The nurse is caring for a child suspected of having bacterial tracheitis. Which of the following is the primary clinical manifestation that the nurse assesses supporting this diagnosis? A. Fever. B. Brassy cough. C. Thick purulent tracheal secretions. D. Inspiratory stridor. Answer. C. Thick purulent tracheal secretions and thick purulent tracheal. Rationale. Bacterial tracheitis is a bacterial infection involving the mucosa of the upper trachea. Although fever, brassy cough, and inspiratory stridor are all clinical manifestations of bacterial tracheitis, the hallmark manifestation diagnostic of the condition is thick, purulent tracheal secretions. If left untreated, these secretions may result in airway obstruction or even respiratory arrest. 5. The nurse is reviewing the chart of a child with coarctation of the aorta. Which of the following findings would the nurse anticipate? A. Congestive heart failure. B. Cerebral hypertension. C. Hypoxemia. D. Femoral artery hypertension. Answer. B. Cerebral hypertension. Rationale. Coarctation of the aorta is a stenosis most commonly located within the thoracic aorta that increases systemic resistance at the site of the coarctation. This causes an increase in pressure proximal to the coarctation, causing hypertension in the cerebral arteries. Arteries distal to the coarctation have reduced pressure, causing lower extremity hypotension. 6. The nurse is planning care for a 2-year-old child immediately following cardiac catheterization. Which of these activities should have the highest priority? A. Change the dressing at the puncture site. B. Apply direct pressure to the catheterization site for at least 15 minutes. C. Monitor the heart rate for at least 1 minute during vital signs. D. Start oral fluids. Answer. B. Apply direct pressure to the catheterization site for at least 15 minutes. Rationale. Direct pressure on the site for 15 minutes and frequent monitoring of the occlusive pressure dressing will decrease the risk of complications from hematoma or hemorrhage following cardiac catheterization. The dressing should not be changed immediately post-procedure, as disruption of the clot may cause life-threatening hemorrhage. Monitoring the heart rate for 1 minute during vital signs and starting oral fluids are appropriate actions in postoperative care, but are of lower priority in the assessment and care of the child immediately post-op. 7. The nurse includes which of the following in a discharge teaching plan for parents of a child who has just undergone a cardiac catheterization for a cardiac defect? A. Monitor the dressing and stitches until the return appointment. B. Maintain the post-surgical clear liquid diet for 48 hours. C. Use a home cardiac monitoring system. D. Administer antibiotics for 2 weeks. Answer. D. Administer antibiotics for 2 weeks. Rationale. After a cardiac catheterization, the dressing will be removed before discharge and stitches are not necessary for this procedure. The post-procedure diet is the child's usual diet, and home cardiac monitors are not used after cardiac catheterization. Antibiotics are used for children with heart defects prophylactically to minimize the risk of infection. 8. The nurse asks the mother of a child suspected of having a congenital heart defect about eating patterns and activities. Based on an understanding of this child's condition, which of the following should the nurse consider before recommending a plan of care? A. Poor feeding and activity intolerance are common in children with congenital heart disease. B. The child's favorite foods and playtime activities. A. C. The parenting techniques should be assessed. D. Meal times should be coordinated to the child's activity schedule. Answer. A. Poor feeding and activity intolerance are common in children with congenital heart disease. Rationale. Poor appetite and feeding patterns and activity intolerance are common to many congenital heart diseases. This is the primary consideration for the nurse before recommending the child's plan of care. 9. The nurse is evaluating heart sounds in 4 children. Which of the following heart sounds found in a 4-year-old child does the nurse report as pathologic? A. S1B, S2C, S3D, S4. Answer. D. S4D, S4. Rationale. The S1 and S2 are normal heart sounds at the beginning and end of ventricular systole. The S3 sound occurs early in diastole and is considered normal in children and young adults, but is a sound of cardiac disease in older adults. S4 is a rare sound and not heard in a normal heart. 10. A 5-year-old child is scheduled for an echocardiogram. She asks the nurse if the test will hurt. Which of the following is the nurse's best response? A. It is different for everyone. B. I'm not sure. You should ask your physician. C. There will be a jelly that will feel cool, but it won't hurt. D. The various positions you will have to assume may cause a little discomfort. Answer. C. There will be a jelly that will feel cool, but it won't hurt. Rationale. An echocardiogram is non-invasive and painless. The child needs to be reassured. 11. The nurse is caring for a child with Tetralogy of Fallot who experiences an episode of acute cyanosis. Which of the following is the primary clinical manifestation the nurse will assess? A. Decreased respiratory rate. B. Decreased pulse rate and blood pressure. C. Loss of consciousness. D. Anxiousness and irritability. Answer. D. Anxiousness and irritability. Rationale. Tetralogy of Fallot is comprised of a ventral septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. During a cyanotic spell, pulse and respiratory rates increase to compensate for decreased oxygen levels. Anxiety and irritability are the most common manifestation in children with hypoxic spells. Loss of consciousness is more likely to be seen in states of severe heart failure. 12. Which of the following should be included in the discharge teaching the nurse is preparing for the parents of a child with Tetralogy of Fallot? A. Demonstration of suctioning procedures. B. The signs of infection. C. Use of the knee-chest position for cyanotic spells. D. Complete bed rest. Answer. C. Use of the knee-chest position for cyanotic spells. Rationale. Tetralogy of Fallot is comprised of a ventral septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. The use of the knee-chest position is effective in decreasing cardiac workload. Complete bed rest is inappropriate, as much normal activity as can be tolerated is encouraged. Signs of infection and suctioning are not a part of the care for a child with Tetralogy of Fallot. 13. The nurse is caring for a child with Kawasaki disease. Which of the following would indicate to the nurse that the client's condition is deteriorating? A. Bradycardia. B. Strep throat. C. Arrhythmias. D. Hypotension. Answer. C. Arrhythmias. Arrhythmias. Rationale. Kawasaki disease is a multisystem vasculitis that affects the coronary arteries. Hypotension and strep throat are not manifestations seen in Kawasaki disease. Cardiac complications are the most serious and contribute to morbidity and mortality. Tachycardia, a gallop rhythm, and congestive heart failure may occur. 14. The nurse is caring for a child with a possible diagnosis of rheumatic fever. Which of the following assessment findings does the nurse evaluate as a diagnostic criterion? A. Decreased erythrocyte sedimentation rate. B. Bradycardia. C. Elevation of antistreptolysin levels. D. Desquamation of the fingertips. Answer. C. Elevation of antistreptolysin levels. Rationale. Streptococcal infection precedes the development of rheumatic fever by approximately 2 weeks. Elevation of antistreptolysin levels indicates a recent strep infection. 15. When preparing discharge teaching for a family of a child recovering from rheumatic fever, the nurse's priority instruction is: A. The child needs to take prophylactic antibiotics to prevent endocarditis. B. The child should resume school activities as soon as tolerated. C. Parents should inform the school nurse of the child's illness. D. Parents should monitor the child for poor appetite and growth. Answer. A. The child needs to take prophylactic antibiotics to prevent endocarditis. Rationale. Rheumatic fever is thought to be an autoimmune disorder related to group A streptococcal infection. Future streptococcal infection and the risk for endocarditis can be prevented with prophylactic antibiotic administration. Resuming school activities and informing the school nurse about the illness may be appropriate interventions, but they are of lower priority. Poor appetite and growth do not generally occur with rheumatic fever unless the child already has experienced significant heart damage. 16. Which of the following should the nurse include in the discharge instructions for an infant with an atrial septal defect? A. Discussion of speech development. B. Cardiopulmonary resuscitation. C. The necessity of monitoring for obesity. D. Home oxygen saturation monitoring. Answer. B. Cardiopulmonary resuscitation. Rationale. An atrial septal defect is an abnormal connection between the right and left atria. Children with any heart defect are at a higher risk for heart failure. Instruction in cardiopulmonary resuscitation increases parental confidence and prepares them to handle an emergency. 17. A child's mother asks the nurse how her child got hypertension and what it means. In explaining hypertension in children, the nurse would most appropriately respond that in children, hypertension is A. Generally related to another disease process. B. Generally not treated. C. Usually nothing to worry about. D. Related to cholesterol levels. Answer. A. Generally related to another disease process. Rationale. Secondary hypertension is much more common in children than primary hypertension. It is usually a manifestation of another disease process. Hypertension in children is of concern and treatable. The association with cholesterol is not applicable. 18. Which of the following should the nurse include in the preoperative teaching for the parents of a child scheduled for cardiac surgery? A. A warning to avoid bringing toys from home to the hospital. B. A warning that siblings should not visit. C. Concepts of pain management. D. A tour of the general pediatric care unit. Answer. C. Concepts of pain management. Rationale. Lieutenant is appropriate to instruct the parents of a child scheduled for cardiac surgery in the concepts of pain management. Toys from home to be comforting to a hospitalized child, as can sibling visits. Siblings are also comforted by seeing the child in person. Although a tour of the intensive care unit is appropriate, the tour of general pediatrics can come later as necessary. 19. A nurse caring for a young child with a newly diagnosed atrial septal defect would A. Prepare the child for echocardiogram. B. Discuss life expectancy with the parents. C. Assess for signs of liver damage. D. Monitor the child for cyanotic spells. Answer. A. Prepare the child for echocardiogram. Rationale. An atrial septal defect is an abnormality between the left and right atria. A chest X-ray and an echocardiogram are generally performed to demonstrate the increase in the heart size and location and size of the defect. Cyanotic spells are generally not seen in atrial septal defects. Cyanosis itself is rare unless the defect in the septum is large enough to allow significant mixing of oxygenated and unoxygenated blood. 20. To reduce cardiac workload, the nurse should implement which of the following nursing interventions for a child in heart failure? A. Place the child in Trendelenburg position. B. Encourage fluids. C. Schedule regular meals 3 times a day. D. Provide a quiet environment. Answer. Laughing face. Provide a quiet environment. Rationale. Placing a child with a cardiac condition in a Trendelenburg position and encouraging fluids would actually increase cardiac workload. The preferred method of feeding to reduce cardiac workload is to feed 5 to 6 small meals a day. A quiet environment reduces stress and anxiety, resulting in a reduced cardiac workload. 21. The parents of a 3-year-old child with Tetralogy of Fallot tell the nurse that their child frequently squats during play. Based on an understanding of Tetralogy of Fallot, the nurse recognizes that this is A. Normal for the child's developmental age. B. A sign of constipation. C. A compensatory mechanism. D. A disinterest in engaging in play. Answer. C. A compensatory mechanism. Rationale. Tetralogy of Fallot is comprised of a ventral septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. Squatting helps the child's circulatory system compensate for episodes of hypoxemia, especially during active periods. 22. Which of the following should the nurse include in the plan of care for a child diagnosed with secondary hypertension? A. Weight control. B. Managing cholesterol levels. C. Use of diuretics. D. Treatment of the underlying condition. Answer. D. Treatment of the underlying condition. Rationale. Secondary hypertension in a child is related to an underlying disease process. Treatment of that condition will most commonly significantly improve the hypertension. Weight control, use of diuretics, and managing the cholesterol level are common treatments for primary hypertension, which is rare in children. 23. The nurse caring for an infant with patent ductus arteriosus informs the parents that corrective surgery will prevent A. Pulmonary vascular congestion. B. Increased systemic venous pressure. C. Cerebral vascular hemorrhage. D. Hepatomegaly. Answer. A. Pulmonary vascular congestion. Rationale. The ductus arteriosus is a direct connection between the main pulmonary artery and the aorta. When the connection remains open several weeks after birth in a full-term infant, it is a patent ductus arteriosus. Patent ductus arteriosus causes an increase in blood flow in the reverse of what it was in fetal life as systemic pressure increases relative to pulmonary pressures. This causes an increase in pulmonary flow through the pulmonary artery. Pulmonary vascular congestion is the risk in this. 24. Which of the following is the nurse's priority intervention in a child with pulmonary stenosis? A. Monitor for indications of congestive heart failure. B. Educate the parents regarding home medications. C. Provide sensory preparation for a chest X-ray. D. Discuss the child's nutritional and developmental needs. Answer. A. Monitor for indications of congestive heart failure. Monitor for indications of congestive rationale. Pulmonary stenosis is a narrowing of the pulmonary valve and obstruction of the blood flow from the right ventricle to the lungs. Monitoring the child for congestive heart failure is the priority as it is potentially life-threatening. Provision of sensory preparation for the X-ray is also important but not as significant as monitoring for congestive heart failure. Educating the parents about home medications and discussing the child's nutritional and developmental needs are appropriate interventions later in the hospitalization. 25. A child with an atrioventricular canal has been experiencing difficulty breathing and productive cough for 3 days. On admission, the nurse notes nasal flaring and retractions. At this point, the nurse's priority action is to A. Inform the physician of the client's worsening condition. B. Administer oxygen via mask. C. Reassure the parents. D. Obtain the child's weight. Answer. B. Administer oxygen via mask. Rationale. An atrioventricular canal is a defect that allows blood to flow among all 4 chambers. An atrial septal defect is continuous with a ventricular septal defect along the septum, also affecting both AV valves, creating essentially one large chamber. Blood flow direction depends on the child's peripheral resistance and pulmonary resistance as well as ventricular pressures. This defect is seen in Down syndrome. This client is experiencing labored breathing and requires oxygen immediately. This can be applied quickly before calling the physician. Reassuring the parents and obtaining a weight are also important interventions, but immediate oxygen could reduce the difficulty of breathing for this child and help stabilize the condition. 26. The nurse is assessing an infant who has been transferred from another facility for examination of possible cardiac anomalies. The child has congestive heart failure, is severely cyanotic, and is on mechanical ventilation. The chest X-ray shows an abnormally large right ventricle and a very small left ventricle. The nurse recognizes that this is most likely a. Coarctation of the aorta. B. An atrioventricular canal defect. C. Truncus arteriosus. D. Hypoplastic left heart syndrome. Answer. D. Hypoplastic left heart syndrome. Rationale. Hypoplastic left heart syndrome is characterized by a lack of development of the left ventricle secondary to mitral valve atresia or aortic atresia. The result is a small hypoplastic left ventricle not capable of cardiac function. 27. The registered nurse is preparing clinical assignments for a pediatric unit. Which of the following nursing assignments may be delegated to a licensed practical nurse? A. Instruct the parents of a child with septal defect in cardiopulmonary resuscitation. B. Inform the parents of a child with an atrioventricular canal of the clinical manifestations of congestive heart failure. C. Assist a child with a Fallot or a knee chest position during an acute hypoxic spell. D. Assess a child with tricuspid atresia for growth retardation and failure to thrive. Answer. C. Assist a child with Tetralogy of Fallot or a knee chest position during an acute hypoxic spell. Rationale. Nursing assignments involving skills such as instructing, informing, or assessing should be performed only by a registered nurse. A licensed practical nurse may assist a child with Tetralogy of Fallot or a knee chest position during an acute hypoxic spell because the initial instruction has taken place. 28. A mother brings an 8-month-old infant into the health clinic. An examination reveals that the infant's height and weight are below the 5th percentile, skin is dry and wrinkled, the abdomen and muscle wasting is evident. The most appropriate nursing diagnosis for this child at this time would be A. Risk for injury related to parental abuse. B. Failure to thrive related to unknown causes. C. Diarrhea related to deficiency in essential nutrients. D. Social isolation related to lack of maternal-infant bonding. Answer. B. Failure to thrive related to unknown causes. Rationale. A diagnosis of failure to thrive is an appropriate nursing diagnosis for an 8-month-old infant who falls below the 5th percentile, and has dry and wrinkled skin, a protruding abdomen, and muscle wasting. Although a child with diarrhea may have the clinical manifestations of failure to thrive, diarrhea is not a presenting manifestation. Diarrhea is a diagnosis in itself, but may be a defining characteristic of imbalanced nutrition. 29. An infant, who has had a cleft palate repair, is positioned side-lying or on the back. The rationale for this positioning is that it A. allows observation of the suture line. B. Decreases anxiety. C. Promotes drainage. D. Facilitates oral intake. Answer. C. Promotes drainage. Romote's rationale. After surgery for a cleft lip and palate repair, increased salivation is expected and aspiration is a potential complication. Positioning the child in a side-lying position maintains an open airway and facilitates drainage. The suture line is usually not observed unless bleeding is suspected. The rationale for the side-lying is to maintain a patent airway and promote drainage, which in turn will relieve anxiety. Prone position is not suggested as a means to facilitate feeding unless the medical condition prevents any other positioning. 30. The mother of an infant who has had a cleft lip repair tells the nurse that the physician said it was very important not to let the baby cry and wants to know why. Which of the following is the appropriate response by the nurse? Crying. A. Impairs breathing. B. Stresses the sutures. C. May result in gagging. D. Leads to crusting. Answer. B. Stresses the sutures. Rationale. Crying stretches the facial muscles, especially those around the lips, which stresses the suture line and leads to potential separation of the incision site following a cleft lip and repair. Impairment of breathing and gagging are more of an issue with cleft palate. Scarring occurs as a result of suture line crusting and tissue trauma from rubbing. Thank you.